I do believe we are live now. I don't think the actual chat on what's it called on YouTube has caught up yet, but it should do in just a second. Oh, we are live. Hey guys, what's up? How are we all doing? I've been seeing the chat. I see that you guys are all doing well. It's nice to see. I have with me here Tracy. Okay, it's something. Bear with me. Let me know before we even get started. If it's laggy, guys, let me know because I might have to move to a different room. But it seems to come and go, but it seems to be fine for the most part. But let me introduce Tracy. Tracy actually reached out to me when I said I would like to talk to somebody who is more knowledgeable in diabetes than myself. Now, she's not a nutritionist and she's not a doctor and not a dietitian, but she is a nurse and she actually works in disease prevention. Is that what we work in?
Disease management. So I help
disease management
people who already have the disease hopefully try and control it.
Yeah. And she was telling me a little bit about it. It's really interesting. We'll probably get into that a bit more later. She also used to struggle with her weight. I saw her pictures on WhatsApp when we started talking, and she's undergone quite a transformation herself. So she comes from the perspective of somebody who has also struggled with obesity. So that's interesting to take into consideration too. And yeah, she's just gonna tell us about diabetes, the various things to look forward to, diet in general, etc. So, Tracy, why don't you introduce yourself and tell us a little bit about yourself?
Well, like Alona said, I am registered nurse. I have actually been in some form of healthcare for over 20 years. I've been a registered nurse for over 20 years. The last 11 years, I've been a disease management coach. So basically, I work with a company who we work with other companies that, as an added benefit to their employees, give health coaching. And so my expertise is with people who actually have chronic conditions like diabetes or coronary artery disease, something like that. So this is kind of my repertoire all day long. You know, again, like Alona said, I do not diagnose, I do not prescribe, but I do help provide personalized plans for my clients to kind of control their diabetes and other health conditions. I love my job. I am the lucky person who is doing what they wanted to do as a kid. And then, yes, I have my own weight struggles. I have polycystic ovarian syndrome, endometriosis, all those things that people use as an excuse for not being able to lose weight, which I did as well. But I also worked really closely with doctors trying to lose weight. I was on medications, phentermine, things like that, and I would stall, and I would be the strictest person ever. If you told me not to eat carbs, I wouldn't even eat a carb from a fruit or a vegetable. I literally could keep my carbs under 10 grams a day, and I still wouldn't lose weight. I would get my 10,000 steps in before 5 a.m. And I would always stall. So I did, in hopes of preserving my fertility, 4 years ago, undergo gastric sleeve surgery. I was not obese enough for insurance to cover it, and I had no health conditions, luckily, at the time, but I know I have a family history of heart disease, and I wanted to be proactive, so I paid out of pocket for that surgery. And hardest yet best thing I've ever done in my life. So I can come at it from both sides of the coin of being, I was still in the obesity category, but just morbidly obese. And just wanting to be healthier overall.
Yeah. Do you mind me asking you, do you think that you were ever at one point kind of in denial about your health problems where you were overweight? And can you, now that you've lost weight and you're a lot fitter, can you notice a difference in terms of aches and pains that you would have, but you probably, I don't want to assume that you may not have recognized at the time. Is there a big difference between how you feel now compared to how you felt then?
Well, I wouldn't say with aches and pains and things like that because I was lucky. I will, full on say I was lucky and I did not suffer from anything like that, bad joints, anything. But energy levels, mood, depression, things like that have all greatly improved. And honestly, I'm mad at myself for not doing this sooner.
Yeah. And what made you do it? What was the deciding factor for you to go like, okay, now I will go and have the gastric? Did you have the sleeve or the bypass?
I had the sleeve.
Yeah. What made you decide to?
I don't have
go
blood
into
sugar
that?
issues, and the gastric bypass tends to lower people's blood sugars. It'll actually reverse diabetes. And I suffer from low blood sugar, so I chose the sleeve. Not as successful of a surgery in general. But I was 41 and I was like, I still want to try and have a kid. I'd gone through fertility treatments in the past and I thought, you know what? They always say that after these surgeries, your fertility just bounces right back up. And so that was probably one of the major factors. The other is that, again, like I said, I have a lot of health issues, particularly heart issues on my mom's side of the family. My grandfather died in his early 70s, so did my grandmother. My mother had an autoimmune disorder that caused blood clotting, that caused a heart attack, and she had heart problems. And I took care of her for 2 years before she passed away. And I just thought, I don't want to be that person. I don't want to be in that situation. So mine
Yeah.
was really all focused on, I'm single, I live alone. I don't want someone to find me, on the floor being eaten by my cats and my dog.
I don't think anybody wants that, but yeah, that is a good incentive. What I was going to say or ask is now, because of what you do with your work, do you think that with the knowledge that you have accumulated over the years of working with people with all kinds of problems, including diabetes, etc., do you think it would have been possible for you to lose weight or fat by willpower alone and dieting, or do you think that having that sleeve was quite crucial? I'm basically what I'm trying to say is like, yeah, do you think that with the knowledge you have, do you think it would have been possible because of what you now know more about just having applied your knowledge in terms of nutrition, etc., to other people?
Yes and no. I would lose weight to a point, but I would not have gotten to a healthy weight for me.
Right.
And it was a lot of hormonal things. Like I said, I've got a lot of different hormonal things, and I'm sensitive to estrogens and things like that. I had a blood clot in my lung caused by birth control pills. So with my hormonal issues, I would get to about 190 pounds, and then I would stop. But like I said, I did it on my own, but I also did it with doctor's help. I saw a nutritionist beforehand. So I didn't go into this going, oh, here's my magic cure and I'm just going to be perfect now. I put a lot of work over a lot of years into it before I made that decision. And most of that is because of the job I have now. When I was working in the hospital, I was mostly working with trauma and oncology patients. And I'll admit, it's like, oh, I went to the gym. I can go, have a burger now. I was not great most of the time, but when I did start learning about the stuff and start making the changes, yes, I lost weight, but just did not get down to a healthy level.
Yeah, that's fine. Now, I was just curious. Do you think that do you think that weight loss or fat loss is possible for everybody? Do you think that people get to a point of no return and they need to, I'm being hyperbolic here, but essentially be strapped down and starved? Or they do need to have something like something like a bypass or a sleeve, obviously with the therapy, etc. as well. Do you think that from your experience that some people, it's just the damage that they have done in terms of hormonal imbalances, it's very difficult to rectify it by just applying willpower and they can go like, there you go, here's a clean diet.
Yeah. I think that anybody can lose. I think anybody can get down to a healthier weight without surgery. Sorry about that.
That's me. Don't worry. That's me every time I film. Don't worry.
But I mean, it depends on what their overall goals are. But yes, I think that somebody can definitely lose the weight. There's no reason why you can't get down there. I think in your video yesterday, you were saying that somebody sent you a clip from like My 600-Pound Life. And when somebody is I've watched those shows, and when somebody is following that 1,200 calorie a day diet, they will lose 50 pounds in a month when they're that obese. Will they necessarily get down to a quote unquote healthy weight? Hard to say. You have to put in the work. And it's only, in my opinion, it's only once you put in the work, do you then get to decide if you're going to be the person that is able to lose weight. But in general, I really do feel that if people put in the work, they can lose some weight. And it all just depends on what the end goal is.
That's good. That's good to hear. So tell us a little bit about diabetes, because that's really why you're here. We kind of got sidetracked, but that's fine. We're having very interesting conversations. But yeah, let's talk about the main subject of this live stream and diabetes and your knowledge on it.
I think first off, really just people need to know the difference between the types of diabetes. Type 1 diabetes can be diagnosed at any time, but that's often what you hear of as like juvenile diabetes. And basically, that's an autoimmune disorder where your body does not produce any insulin. So you have to inject it to replace it. Nothing can be done. Unless you have a pancreas transplant, it's never going to get reversed. And that is the type of diabetes that, when we hear about carb counting, is really, really important, because you have to medicate yourself for the carbs you're going to eat. Now, the funny thing is the majority of people with type 1 diabetes do not do well on like a keto diet.
Interesting.
Logic would tell you, okay, so don't eat carbs, you'll be fine. But with that balance and the way that they just have no insulin, it does not tend to work well. Again, that's for the majority. There are some people that do really well on it. Now, of course, type 2 diabetes is the most prevalent. And basically, your cells can become insulin resistant. So if you think of like a lock and key analogy, the insulin unlocks the cells like in your muscles, things like that, to allow the glucose to go in for energy. And with insulin resistance, those keys don't open as well.
Right.
And then, over time that happens. Your pancreas can actually wear out and stop producing insulin. So that's where you get a type 2 diabetic that needs extra insulin. So insulin resistance can be caused by a couple of things: hormone imbalances, polycystic ovarian syndrome, and the such is a really common cause of that. But also what we call metabolic syndrome comes from, there are 5 things, and if you have 3 of them, you're considered at a potential for metabolic syndrome, and that is a waist size over 35 inches for women or 40 for men, a low HDL, which is your good cholesterol. It's happy, you want that high, and it should be above 50 for women and above 40 for men. If your triglycerides are high, your fasting blood sugars are high, or your blood pressure being over the recommended 120/80. So if you have 3 of those, probably have metabolic syndrome or the starts of it, and that is going to affect your insulin resistance as well.
Oh, right. That's interesting. I thought metabolic syndrome was basically, I kind of read up about it a little bit, and I was always under the impression they are just, what's the word? They're not kind of like not comorbidities, but there certain like things, that's not really the right word to say, but certain things that somebody has, and it's all, I mean, a lot of it is direct. Actually, is it correlated to obesity, or can you have metabolic syndrome and not be obese?
You can have metabolic syndrome and
Technically, I
not be
suppose.
obese. Yeah, there are some, when it comes to diabetes, genetics plays a part. There are some cultures that are more genetically predisposed to diabetes despite having a normal weight, and that is really prevalent in Asian communities,
Yeah.
Indian cultures. So unfortunately, I always tell my members, those are genes you can't return to the store. We got to work with what you
Yeah.
got. So yeah, you can be, but in general, for the majority of people, yeah, it is related to obesity. And of course, it can be managed through diet, exercise, um, depending on the severity.
Yeah. Yeah.
At
Yeah.
some point, diet and exercise isn't going to help anymore when your pancreas is working overtime.
Yeah. You have to be
Um,
careful as well, because you could potentially do more damage, I suppose. I don't know, with that, could you ever really do a lot of damage with diet? Except for maybe if it's an unhealthy diet, but if it's a healthy, balanced diet, whole food diet, can you ever really do damage with that?
not not really in my experience. I'm a big advocate of like what you have said of like 80/20. 80% of your food is whole foods, 20% is maybe processed or
Tasty
prepared
things.
and things like that. I have been saying that for, over 10 years. That has kind of been my philosophy. I live it myself. I always tell my members, if I can't do it, I can't really ask you to do it.
Yeah.
So yeah, if you're eating that way, and it's not, it's one of those things, is it's got the potential to help and it's not going to hurt. So why not try it?
Yeah. Yeah. That's true.
Yeah. And I mean, your biggest risk factors for diabetes are obviously weight, but also fat distribution. If you hold most of your fat in your abdominal area, again, that's why the recommendations are for women with a waistline of less than 35 inches and men 40. Um, Not exactly sure why, but storing fat in that area increases your risks for diabetes.
It must
Um,
just be to do with all the fat that sits around the organs, creating just in general a lot more pressure and less oxygen flow and all of that. It's just not good to have. I saw who posted this the other day. I don't know. I was following somebody on Instagram and they posted a heart of a healthy person and an obese person, and the obese heart was just covered in fat,
yeah,
basically. Yeah, and it's
that's
just
the
shocking. Like
visceral
you've got to
fat.
just imagine their whole internal organs just being like that. It can't be good. So
Yeah, and the non-alcoholic fatty liver, like what Chantal has said she has, really increases your risk of diabetes, and then of course the inactivity. Sorry, the cat. Um,
that's all right.
yeah, your cells want, and now of course, again, unless you're doing keto or something like that, in general, for the majority of us, our cells want to use glucose as their first line of energy. So if you're not being active, then all that um, carbohydrate is being turned into sugar, and that is going through your, bloodstream. And when you think about that, again, the best analogy is I have is think of it as little shards of glass. It's roughing up the insides of your blood vessels, which then allows platelets or cholesterol or things like that to attach more easily to the sides of your blood vessels, and then puts you at higher risk for developing things like blood clots, heart disease. So, I mean, it
Yeah,
all goes together. Um, but that intraperitoneal fat is the fat around the abdomen, and I don't just mean what's under the skin. It's like you said, it's what's around the organs, things like that. That is your biggest indicator of metabolic syndrome and diabetes potential right there.
Right. So you were telling me when we were talking backstage, you were saying about A1C and just blood glucose reading. And I actually made an error about that in a video before where I said, oh, I'm testing my A1C and it was this. But actually, your A1C, I believe, gets tested over a certain period of time. And what I was going to ask you is like, well, first of all, is that correct? And second of all, is does your doctor test your A1C? How often would they check it? And how often would they check it at random intervals in the days? Or is it only purely fasted? And yeah, tell us a little bit more about that.
Your A1C does not need to be fasted at all. It's not going to affect it. What they're testing is the sugar will stay on a hemoglobin molecule for about 3 months. That's why it's a hemoglobin A1C. So when they do that test, it can give them an idea of what your blood sugar has been over a 3-month period or so. So if you have diabetes, 3 to 6 months is the recommendation that they check that, because of course it's not going to change very quickly. If you're a healthy person with no history of diabetes, no signs of diabetes, then that would be something, annual physical. But they should be checking it. Now, the reason why there's a little, misconception about what those numbers are is, of course, in the United States, we do things completely backwards from the rest of the world. And it's, of course, I'm not going to remember this because I didn't write it down, but it's like millimoles per deciliter for Europe and Canada, and milligrams per deciliter in the United States. So, whereas I think I saw somewhere, and I had to look this up myself because when Chantal said her blood sugar was 17, and I'm like, I've never heard of an A1C that high, and that's where I kind of looked it up and learned. So that blood sugar of 17 would equal a U.S. blood sugar of like 305. Not horrible, but not the worst I've ever heard.
Oh, so to me, both sound high. But then, did she say
they are both very high, but...
So is your A1C different from your blood glucose reading? Because I've done the blood glucose. Oh, okay. So what's the difference? Because I think I kind of missed that part here. Because obviously, when you prick, what does that test as opposed to an A1C? Is it just a different? It literally just looks at a different part of the blood. Like, sorry, I'm just being dumb here, but it's just kind of gone over my head.
When you're checking your blood sugar, it is literally just counting the sugar molecules in your blood at that moment.
Right.
Whereas your A1C gives you kind of a range by checking how many sugar molecules are on that hemoglobin that have been there for 3 months.
Right, I see. So it's almost like one test is an accurate test in time as it is right now, and the other one, it looks at what the body has been doing for the past 3 months in hindsight, kind of.
Exactly. And there's a reason that we don't diagnose diabetes off of a blood sugar reading, because it fluctuates day to day, hour to hour, minute to minute. I mean, if I sit here and drink a Coke and check my blood sugar in 5 minutes, it's going to look like I have diabetes. Whereas if we look at that A1C over time, it shows how your body is utilizing insulin you produce. Are you, drinking that Coke, getting that high blood sugar, but then the insulin is working to bring it back down?
Right. So, talking of eating foods that spike the insulin, obviously sugars do it, but then you have your low glycemic carbohydrates. I mean, I think from ones that basically everything you eat will have some insulin response. Just some foods a lot more than others, including simple sugars being some of them. And I think, myself included, a lot of people fall into that, not the trap, but into the studies that are out there, probably more so around the type 1 diabetes people, that if you have diabetes, you should really minimize your carb intake. Obviously, you should always minimize your simple sugar intake. That's I don't even want to go into that, but I just mean even like healthy carbohydrates. Yeah, you know, like even your healthy carbohydrates, your good carbs, shall I say? Not, you know, not that you should say good or bad first, but people know what I mean. But actually, funnily enough, he's in the chat now. Anthony pointed out, and somebody else, that actually a lot of it is to do with simply reducing the fat cells and still having carbohydrates in food, because they are not necessarily contributing to it. It is just the fat cell, the number of fat cells within the body themselves. So, what's your experience with that, with helping people out?
Well, first off, you're absolutely right. We don't need a lot of simple sugars, but I always tell people, sometimes
It's
you
nice.
you want it and you have it, but so it's always on the food pyramid, but it's at the very tippy top. You don't need a dessert after every meal or every day.
Yeah.
That kind of thing. The most important thing, again, with type 1 diabetics, you need to know the number of carbs you're eating so you can medicate against it. And that's can be good or bad. I have talked to plenty of diabetics who are like, I eat whatever I want and I just give myself insulin. Not the best idea. It's not my recommendations for people. One of the biggest things is keeping you may not have to count carbohydrates for type 2 diabetes, but with anybody, diabetic or not, you can avoid those sugar spikes and drops, which then increase hunger cues. But as your sugar drops, your brain goes, oh, I need more sugar. I need energy. I need it. So if you can keep it even. So that's usually a big recommendation is, if you can keep maybe, if you're not going to be on a low carb type diet, 45 or so carbs per meal, 15 carbs for a snack. You don't get to save up all your carbs for dinner.
Right.
And being able to keep that blood sugar even. The other thing is, if you add protein and fiber to the carbs that you're eating, it's going to slow down how fast the sugar molecules are released into the bloodstream, and again, give you a more even blood sugar. So a lot of times I'll talk to people, they'll be like, well, I have oatmeal for breakfast, or I have a smoothie. And I say, okay, when are you hungry again? They say 2 hours later. So my
Yeah.
suggestion is, add some nuts or seeds to it, add some protein to it. And usually that will keep them satisfied longer. So then there's not as much snacking. The other thing is the whole foods. I mean, yeah, we think of our low glycemic carbs, things like that, but a potato is going to be better than a potato chip, not necessarily even just because of the fried and all that, but you've got more fiber, especially if you're eating the skin. If you add minimal amount portion controlled sour cream to it, you're getting some protein there. It is going to give you that more even blood sugar. So it may be technically the same amount of carbs, same food, but
Same
they're going
food
to
group.
work
Yeah.
differently.
Yeah.
And that is my biggest thing, that 80-20 of whole foods versus processed foods.
Yeah.
Because, and again, if fat cells, especially around the midsection, things like that, are the biggest indicator, dropping your fat is also going to help that blood sugar, or making sure it's healthier fats in moderation.
Yeah.
I'm a big fan of everything in moderation. The majority of people cannot stick to something that is restrictive.
Right.
And that's why, a lot of like New Year's resolutions don't work. I'm never eating chocolate again. No one's sticking to that
Yeah.
unless they're allergic to chocolate or hate chocolate to begin with. So, having 44, 150 grams of carbs in a day, not necessarily a bad thing when it's spread out through the day. And
Yeah.
also
So
being
that
whole
leaves me.
food carbs.
Yeah. So that actually leaves me. Sorry, guys. I am looking at the chat, but what I'll do is when we sort of have finished having a chat, I will open up the chat for questions. I just don't want to interrupt the conversation that we're having. I'm sure you understand. But I did see a question earlier, which kind of ties in quite nicely to what you're saying here about spreading it out. So what's your thoughts then, I suppose particularly around diabetes, around fasting and potentially doing something like an OMAD diet?
Most of the time, depending on how well controlled the diabetes is, things like that, for the majority of diabetics, that's not a good idea.
Right.
Definitely a type 1 diabetic should not be doing a fasting on OMAD.
Right.
Or it's just going to take a lot of things into consideration. If someone is, morbidly obese, if they're taking something like a metformin type medication rather than something that drops their blood sugar immediately, then they could probably do it. They've obviously got plenty of stores of, fat, energy cells, things like that. But for the majority of people, the OMAD is not a great idea for diabetics. And I guess that's
Right.
something I should say is something like metformin, which is your number one first line of medications for diabetes. It doesn't necessarily drop your blood sugar. What its goal is to improve how well the insulin works in your body, to help it open those cells more.
Right.
Then you've got some other medications. I won't go through all the names, but their goal is to lower the blood sugar immediately. Some of the new injections, they get rid of sugar from your system through the urine, and it just drops it immediately. So if you're taking that type of medication and it's multiple times a day or something like that, then you really couldn't do an OMAD type. But there's
Yeah.
nothing to say that you can't, do a form of intermittent fasting, maybe within 6 to 8 hour eating window
Yeah.
instead of, a 1 to 2 hour window.
Right. Right. And but whilst we're talking about medication, what do you know about this Ozempic? Because like it just triggered in my mind. There's a new thing going around. Chantal's been prescribed it. Is it a weight loss diet? Is it a weight loss medication? Is
It
it
is
diabetes related, or does it just happen to have side effects of maybe you'll lose appetite with it?
That's exactly what it is. A diabetes medication. It is not the first line. It's way further down the line for diabetes medications. It
Oh right.
does have a side effect of it does decrease your appetite and it can cause weight loss in people. And there are some of those injections that they're finding out do help with that. And they have prescribed it to people just primarily for weight loss. With the metformin, for example, they'll give that to women with PCOS. I myself tried it, but I have low blood sugar, so it didn't work well for
Yeah.
me for weight loss to try and help that insulin resistance. But Ozempic is meant to be an injection to lower your blood sugars and yeah, has the side effect of reducing appetite, reducing weight. That being said, if somebody eats when they're not hungry and they just eat to eat, what does it matter if you reduce your appetite?
Yeah, that's true.
And that's
Yeah.
that's the
It's
sad
scary.
thing about it.
Yeah, yeah, it is. It is scary to witness sometimes. So if you were to, what do you may not know, but if you were to have, for example, somebody like Chantel in your office, what would you recommend her? Like, what would a typical diet day look like if you were to prescribe it to somebody
Well,
like that
first off,
suffers from similar things like her?
yeah, the first thing I do is have someone keep a food journal, which I'll admit I don't watch Tom Pell's videos. I watch like reactions from you. So I have a limited but good idea of what her diet is like. But generally that's where I start. And then I'll usually start with, okay, let's cut your portions by a quarter for the next 2 weeks, because I usually talk to people every 2 weeks.
Hmm.
And then see how they do with that. And then it is, okay, let's see what's the next thing. What's your next hardest thing you're working with? Because I really do try to personalize it to the person. And my best example is years ago, I talked to a gentleman who was a traveling salesman. He literally ate 3 meals a day at fast food restaurants. He was about 300 pounds, had high
That's crazy.
cholesterol, yeah, borderline diabetes, and he was on the road constantly. And that's all we started with was, I want you to cut your portions back by a quarter. So he'd still go get his Big Mac meal or whatever, but before he started
Just one
eating,
Big Mac, not three. Yeah.
or whatever it was, yeah. But before he started eating, he took a quarter of the burger and a quarter of the fries and threw them out before he started eating. And just in working with that, now he lost about a pound a week. His blood sugars did go down, but we started there. Then it was, okay, what do you think you can do to maybe help you out for one meal during the day that you could bring with you? He's like, well, I really I like turkey sandwiches. I'm like, okay, on Monday, make a bunch of turkey sandwiches so that you can just grab and go. You don't have to think about it in the morning. So it's things like that. But my
Yeah.
first thing with most people is you got to cut your portions. The average person does not have a horrible diet necessarily, but we eat too many portions.
Yeah.
So,
This is, I think as well, it's like, I think a lot of people are unaware of how much they're eating. I think people don't realize that how often they'll stick something in their mouth, they'll have a little nibble here and a little taste there. And before you know it, it's like I do this thing where, especially when I'm dieting, I like to eat things with baby spoons because it makes it last longer. And I eat a lot of things from small plates because a lot of it is optical illusion, especially if you order, I can imagine, like takeout, and you just have all these boxes of food. You don't really comprehend what's there. But actually, if you put it all onto a plate and you're looking at it, you go like, oh, okay, so I've taken a little bit of everything, but actually my plate's full already and I have 4 servings left over. But I don't know, like, how would you go about that though if people don't recognize that that is a problem that they have? If they think that they are eating, normal sized portions, like what they are doing is they don't sit. Do you see what I mean? I think there's a problem there as well, where it's just the mentality of not recognizing, like, no, this is actually a lot of food for a single person. Would you get them to
and
weigh
that is
things out?
exactly why I make them keep a food journal for 2 weeks. The amount of times,
Yeah,
and then my first question to them is, what did you notice? What do you think is a problem? And that's just an eye opener for a lot of people. They're like,
yeah.
well, I sat down with a bag of chips and, ate them while watching whatever the newest Netflix show is. So that's what I say. I say, okay, I want you to take those chips, couple
Put them in a
options.
bowl.
Put it in a bowl, or even though it's a little more expensive, buy the single package things that are portion
Yeah,
controlled. Um, but yeah, you're absolutely right. People do not realize what they're eating, and that's why the food journal is so important. And I let them start with a very basic one where they don't even measure anything out, just so they
but
can
it's just
notice the
yeah,
pattern.
yeah,
Um,
yeah,
and then the next step is, I want you to measure things. I want you to see what a serving is. And
yeah.
again, exactly like you said with the takeout, never eat it out of the package. You put it on a plate. And again, I have them start with a big plate and then work their way down. Um, and also, I am a huge, huge, huge meal prep obsessed person. People laugh. They say my refrigerator looks like Tetris. And
Oh, mine is similar. But the thing is, though, it's like I'm dieting it myself for myself at the moment, and I know that while I'm dieting, I do kind of bang on about it. But the thing is that if you do it right, it does work. And the thing, I find it personally easier to just repeat a lot of the same sort of meals every single day because I don't have to worry about what I'm going to eat next. I know that at 10 o'clock I eat this, and then 3 hours later I eat this. It's just no worries. All I have to do is get a bunch of chicken, cook it up, get a bunch of, I don't know, tenderloin, some rice, do this and this and this, just cook it all up, stick it in the fridge and just work it through. And when it's down, when it's low or finished, just cook some more up. It's super simple. And you're less inclined to, I find, eat food that you shouldn't have if you already have pre-cooked food in the fridge. But that could just be me because I don't like to waste food. I think like throwing away food it's not a good thing to do if you don't have to. Luckily, we have cats, and I go to the shelter now, so if something goes off, it can go to the animals, but it's just not a good thing to waste food.
absolutely. And I fully agree with you on that one. And that's what I do. I am one of those people like you who can eat the same meal for a week. I will meal prep on generally Sunday. I cook enough. Again, I'm single, so cooking a normal size thing, but then I have it in the freezer. And then for those weeks I don't feel like cooking, I just pull out what I have, but I have it set for the week, portion sized and ready to go, like with snacks, food, what have you. I also, my goal in saving money, things like that, is I have to eat my meal prep foods Monday through Friday. That is just my goal.
Yeah.
I can order takeout on the weekend or whatever. And if I want a burger, I'm not going to McDonald's. I'm going to go get a burger from someplace really good.
Yeah. Yeah.
Um, and actually, I've been working on starting my own meal prep channel for people with smaller families because the bigger families, it's like, here's this. But I watch them and they're like, okay, we're going to put 5 cans of beans in here and do this. And okay, we're doing this with all this processed foods. And it's the whole foods. If you want to be healthy, if you want to, again, reduce your risk for diabetes, things like that. I made a full on homemade chicken noodle soup from the stock to the noodles, had a bunch of chicken broth left over, then made my own cream of chicken soup and made,
Sounds good.
some, I call them French enchiladas. They're basically crepes with chicken and broccoli, and I overloaded the chicken and broccoli and cut back the cheese. And I use fat-free milk for everything. So I can still have really good food, but it doesn't have to be unhealthy. And that's
Yeah.
something that everyone goes, well, I just can't eat chicken and broccoli every day. And it's like, well, I
You don't have
could, but I
to.
don't. Yeah, you don't
Yeah.
have
Yeah. Yeah. So yeah, you have to let me know one. If is your channel up now already? Is it, or is it
There
something you
are
want to do?
2 videos up now. I have been learning. So I did post them. It is Meal Prepaholic, but I'm working on adding some more. They're not great. I'll admit it. They're my first 2. And one of them I just got home from the gym. And it's like, if you don't do this right now, you're never going to do it.
Yeah,
So,
yeah. Send me your when we finish. Email me your channel name, and I'll take a look, and I can give you some recommendations on like editing software and stuff like that, and then I can share your channel because I'm sure people would love to see healthy meal prep. Because I find for me, with my vlogs, whenever I do what I eat in the days, they're always really successful. Even though it is a lot of it is the same thing. It's just that I think people want to see what people eat, and especially if you like
mhm.
somebody that's into training or that's being fit, it's like, well, what do you eat? A lot of it is the same, but that's what gets results. So I was thinking, for sort of the last 15 minutes or so, what about I'll open it up to the chat. If somebody's got any questions, I'll bring it up on screen and yeah, we'll go from there. So I saw some people did ask questions earlier. I'm not going to scroll back through the chat. So if you want to reiterate your question, or unless it's been answered, but if you want to ask a question, then knock yourself out. I'll bring it on screen and then we'll just try and work through some here.
And I actually can't see the chat, so I'm going to rely on you.
It's okay. I'll bring it up on the screen so you can see it.
Oh, okay, perfect.
So some people are just talking about meal prep and food journals. I think that's one of the biggest things. If you're struggling with losing body fat, start weighing your food out. It's so surprising how easy it is to overeat. And also if you switch to higher protein and more whole foods, it's not difficult to overeat because of course you can, but it's just not one of those things. Most people that I stick on a whole food plan, the first few weeks they struggle eating all the food. And it's not even crazy high calories. It's not like I stick them on 25, well, some people are, but it depends really. And most people do struggle eating all of the food. It's only once they get used to it, they are able to finish all the meals. And that's usually a couple of weeks. So here is the
And
first
people
one.
who have scale eyes like us, I
Yeah.
think that you still have to, every few months, I go through and start measuring things just to make
Yeah.
sure I'm still on track. So thoughts on salt. Yes, you should be keeping your sodium levels low. Number one is it causes fluid retention. More fluid in your body makes it harder for your heart to pump through, so can cause blood pressure to go up. But you do need salt, so there's no way to be completely no salt. Recommended is 2,000 milligrams a day, which is about 2 teaspoons
Yeah.
total,
So
which
it's
doesn't
just
sound like a
season
lot,
it.
but It's in everything.
You just season everything. What I do is that, well, it depends on what I'm doing, but I'll often just season things after I've cooked it and just put like some salt over it, or just as I'm cooking, just sprinkle some salt over it and that's done. But if you eat processed food, that usually has a lot of salt in it for shelf life and stuff like that. So cook your own food and you can easily moderate your salt intake. But if you train a lot, it is important because you do sweat out salt. And if you don't have enough salt, you'll get cramps and stuff like that. But
Exactly.
there's too much.
How many people actually train that hard, I guess, is the main question. If we're talking the majority of the population, it should stay.
Yeah, definitely. Yeah.
You coach people to handle without rebounding. It's hard. It's hard. It's an ongoing process to keep people from going back into their previous habits. And it's been really hard with COVID. You know, everybody thought that this pandemic stuff was going to last like a month. And here we are a year later. So really, it's just ongoing support and coaching. And if somebody does backslide, there's no judgment for me ever. I don't say, oh, you really, you did that.
You're so
there's
stupid.
No bad, there's no good. Exactly. And that's what I tell people. I say, you have to give yourself some grace. I hate to be the one to break it to you, but you're not perfect and you're not going to be. So it's just a matter of depending on how bad they rebound. Sometimes we go back to step one in the food journal. If it's only been, oh, well, I splurged this whole last weekend. Okay, well, let's just get you back on track for this week. So, but that's the thing, is most people just need support. And if you have someone, whether it be a health coach or just a friend that you trust or a family member that you trust, who can be like, hey, you've got this. Sometimes that's enough. Sometimes it's not. And if it's not, then we really have to look at why. And there have been times that I've recommended people go see a therapist because we need to get to the root of the issue.
Mm-hmm.
And with insulin resistance, the most effective ways to lower it are weight loss, diet, and exercise, depending on what your situation is. Sometimes medications can't be avoided. Sometimes they can be short term and be, as you get on track with the diet, exercise, and weight loss, can be reversed. But if it's hormonal, especially with PCOS, that is the hardest part. And getting your hormones checked, talking to your OBGYN, seeing if you do maybe need some form of hormonal replacement, like a birth control pill, things like that. But honestly, getting on the whole foods and being active is going to be the best thing to help lower that insulin resistance.
Yeah. I've got a good one here because I'm quite interested in this one as well. What's your stance on sugar-free beverages and blood sugar? I love a sugar-free beverage in moderation. I wouldn't replace it for water, but when I'm dieting, I do like a Diet Coke. I'm not going to lie.
Absolutely. And I would prefer people drink water. That is always my recommendation with, again, something in moderation. But if I've got somebody dealing with blood sugar issues and they have every excuse in the book not to drink water, but they'll drink a Diet Coke, even though they normally drink a regular Coke, I'll take it. But I'm also going to try and find ways to get them to increase their water. It's not my favorite. There's no nutritional value. We can have all the conversations about the artificial sugars and, cancer.
But it doesn't do anything for your insulin levels. Does it spike it? Maybe slightly, right? Maybe just.
Not generally, no. I've tested it myself just out of curiosity. So I have anecdotal evidence from myself that I drank Diet Coke and my blood sugar was still 90. Which sounds high to you with your guys' scale, but that's about a 4.
Okay, I don't see any. I don't know if I've missed a question. I'm just looking. They're talking about Diet Cokes and Himalayan salt, from what I can see. The chat's having a conversation amongst themselves instead. I'm sure there'll be something else. Come on, guys. Who else has got good questions for us? Yeah, I like a diet drink because I think sometimes it's nice to just have something sweet, and I hate wasting calories on drinks. Unless it's like a milkshake and I'm having a cheat meal, then milkshakes all day long, I can do that. No, I said all day long, I wouldn't actually have them all day long, but I could sacrifice some calories for the occasional milkshake. But I think drinking your calories is such a waste because the calories, for example, especially in things like the Starbucks drinks, people don't realize how calorically dense they are. So like you have a drink, it doesn't fill you up, but it's like 300-400 calories. I can literally have a meal, an actual meal with 3 macronutrients, and it'd be filling for those same calories. This is why I'm not a big fan of diet drinks, or I know that they work for people, and that's great. If you do meal replacement drinks and they work for you, fantastic. But personally, I would rather eat food for 300-400 calories and have a shake that's 300-400 calories.
I did that with a medical prescribed diet, and yeah, I agree. I couldn't do it. I need to chew. But yeah, my drink of choice is coffee. I do limit myself to 2 a day, or if I'm having a giant one like this, 1. But I make my own fake Starbucks latte. I use either skim milk or almond milk and sugar-free syrup. And so, yeah, that 300-calorie drink is now like 100 calories because I don't want to waste it. I want food.
Yeah.
You can reverse non-alcoholic fatty liver, not quite to perfect, but you can improve it. If you lose body fat, it's going to help reduce the size of those fat molecules on the liver to make it less severe. Basically, you've got, I guess, a set number of fat cells, and it's a matter of how they grow and shrink. And if you have liposuction, you suck them out, you're not going to grow fat in that area again, is the theory. So you can improve it, but you can't ever, depending on how early it's been caught, you can't completely reverse it or cure it, but you can make it much more effective in liver function if you can reduce the amount of fat cells you have on it.
Mm-hmm. This is quite interesting as well with fruit juice. I think like a lot of people think that fruit juice is healthy, which I think it can be if it has like all the pulp and stuff in it. But just juice on its own, it doesn't have much besides just vitamins and sugars, right?
That's exactly it. It has no fiber in it. So is it okay to have? Yes, in moderation. I'm always going to recommend, if you're going to have it, a serving size of juice is 4 ounces. So 1/4 of a cup
It's not much.
or half a cup, not that much. Yeah. And if you are going to have it, have it with your meal. Have a little bit with your breakfast that has protein and fiber, so you don't get a sugar spike. If you're not diabetic, if you're not worrying about calories or weight loss, it's not going to make a difference to you. It's going to make, if that's all you're having, it's going to make you hungrier sooner. And you may make poor choices, something like that. Again, it kind of goes back to not wanting to drink all of your calories. And that's a question I get a lot of times, is what's the difference between like fruit juice and a smoothie? Well, with a smoothie with fruit, you're grinding up that fruit, so you're still getting all that fiber, which is completely gone in the fruit juice. And if you look at the caloric content and sugar content, even with no added sugar fruit juice, unless you're doing something really tart like a no sugar added cranberry juice, which I couldn't do, it's going to have the same pretty much calories and sugar content as a regular Coke.
This is quite interesting. Pardon me. So, well, I'm not sure if this was mentioned already, but what's the best food combinations for maintaining stable blood sugar levels?
Again,
oh,
go ahead.
I was going to say, I'm going to guess just a serving of a complex carbohydrate, a protein, and some healthy fats, I would imagine, and a vegetable with it.
That's exactly it. I feel like I'm quoting Abby Sharp here, but it helps satiety, fat, fiber, protein. That combination is important. And again, not saving all of your carbs for one meal. They have to be spread out during the day. More whole foods than not. That is, if you're looking for like a breakfast, an egg, some, whole grain toast, maybe some avocado
Yeah.
or something like that.
So just something on it's just popped into my head what you were saying about not having the carbs in one meal. Basically, when I've done dieting before for shows and stuff like that, when I would get a cheat meal from my coach, he would always give me, do you call them GDAs, like glucose disposal agents? And it's basically, I don't really know what it is, but I would have to ingest it about half an hour before eating. And then when I would eat a bulk, because I do very low carb or keto dieting, like that would help me absorb the carbohydrates a lot better. I don't know if that's maybe necessarily anything to do with my insulin, but what do you know about that? It's just popped into my head. I'm like, that's what could be a good question to ask. If you know anything about the supplement itself and if it's
I really
potentially
don't know
beneficial.
anything about that. Honestly, I don't. And for you not being a diabetic and your body working correctly, for lack of a better term, and it wasn't hurting anything. I mean, may have been helping for bodybuilding purposes, but I wouldn't see any big problem with it.
Yeah.
But
Yeah,
I
no, I think
honestly
it was.
don't know much about it.
Yeah, I don't know too much about it either. It's just something that popped into my head that it would help with the absorption of the carbohydrates, but I'm not exactly how am I? I mean, the guy's like an actual chemist, so he knows some crazy tricks. But no, I was just wondering if you knew something about it. But it's fine if not. It could just be like a fitness thing that people use when they're on certain diets.
It very well could be. Yeah, it's not anything my trainer. Well, I'm not. I do some powerlifting. I'm not into the bodybuilding or anything, so I'm not at a
Yeah.
competitive level. So that wouldn't even be anything that he would mention to me. But I'll have to look into that because I'm really not aware.
Yeah.
And going back to the food combinations, that goes for snacks, meals, everything. Anything you can do to keep a stable blood sugar throughout the day is going to really be related to that combination of foods.
Oh, there we go. Anthony said GDAs usually have berberis and banabe. Banaba. I don't know. I'm probably butchering that. And they can be marginal, but they do have documented effects. There you go. Interesting. There you go. Learn something new. I'll do one more, and then I'll probably end the live stream. So, what are the factors into the pancreas finally ceasing to produce insulin? How much latitude does someone have before that happens? Good question, Zoe.
Oh, no kidding, Zoe. There's really what factors into the pancreas ceasing to produce insulin is overwork. If your pancreas is constantly producing more and more and more and more insulin, trying to open those cells, whether it either be because of insulin resistance or you have an extremely high carb diet, that's going to be it. There's not really anything else except for just making it work too hard. Or unless, of course, it's an autoimmune type thing, whereas like you would develop type 1 diabetes later on in life, which I have seen happen. And for the latitude, how much does someone have before it happens? A lot, unfortunately. It does not happen overnight. It's time and time and time of being overworked, but the harder you work the pancreas, the sooner it's gonna wear out. Kind of like your knee joints, the more you make it work with a lot of extra weight on it, the faster it's going to wear out. If you think of every
Yeah.
pound of weight that you have puts 4 pounds of pressure on each knee, it's going to wear
That's
out
crazy,
faster.
isn't it? Why you put it like that? Every
Yeah.
pound is 4 pounds of pressure. Wow, that's interesting if you put that into perspective of some some people. How
Yeah, it's
much
like we
weight
got a
must
100-pound person versus a 400-pound person. That 400-pound person's knees are going to wear out 4 times as fast. It's kind of the same thing
Yeah.
with the pancreas. But then again, we also have to look at the genetics and some kind of predisposition for things. But
Mhm.
in general, for again, majority, talking generalities, if you treat your body badly, it's going to treat you badly back and wear out a lot faster.
Yeah, and then some people do just have genetic lotteries. You know, there is people that can be smokers and they smoke 2 packs of fags every day and they never get lung cancer and live to the age of 92. And then there's people who don't smoke at all, and they've been to like a couple of pubs back in the day and they get lung cancer. So I think, but in general, these are I assume just more like outliers from the norm, because
Absolutely.
yeah, it is like there's always some people that are lucky or unlucky one way or another. So, but anyway,
I was just going to say
oh,
that last carb count that you did, I don't know if it was on Chantal or in Berlin, where it was like 300 and something milligrams of carbs or grams of carbs in one meal. You're wearing out your pancreas is working hard,
yeah,
even without diabetes. I mean,
yeah,
even if you don't have
yeah, and
diabetes, it's
obviously,
gonna wear out.
yeah, and obviously, some people are able to metabolize it a lot better if they're maybe like athletes and stuff like that. But then, you know, again, you're talking about the outliers in society who can, you know, their requirements for nutrition are just different from the average person. So.
Yeah, absolutely.
All right. Well, I'll end the live stream here, I think. So thank you very much, Tracy, for joining. It was really informational. I learned a lot. I hope you guys did too. I like doing this. I like doing these live streams. I have to find different topics to do this because this is good. It's good to learn things.
This is my happy place, teaching people to be healthier. This is my goal for sure. So I
Yeah.
love having the opportunity.
Yeah, you'll have to definitely send me across your YouTube channel. I'll take a look at it, and then if you want me to share it, I can. I'm sure people will be interested. But yeah, thanks a lot for coming, guys. I appreciate you all being here. I hope you enjoy the rest of your weekend, and yeah, you'll see me in terms of videos and stuff when you'll see me next. Members, you'll have a video tomorrow, but otherwise, I don't know yet. So see you later, guys. All right, let me just end this.